Hello and welcome to the first edition of Inside OSA, an informational program for people with obstructive sleep apnea. I'm Sherry Smith and this is medical correspondent John Matthews. Like exercise and nutrition, the quality of one's sleep has a direct impact on the quality of one's life. Yet for an estimated 20 million Americans, refreshing sleep is an elusive dream. Inside OSA focuses on the most common form of sleep-disordered breathing and how it can easily be diagnosed and effectively treated. In this edition, we'll learn about the dangers of untreated sleep apnea. We'll talk with some determined people who sought out solutions for their sleep and breathing problems. And John Matthews will give us a primer on OSA, what it is, and how to recognize it. John?
Thank you, Sherry. OSA, or obstructive sleep apnea, is both the most common and the most troubling sleep-related breathing disorder. OSA causes a person to stop breathing repeatedly during sleep. These nighttime pauses in breathing prevent restorative sleep and have far-reaching consequences for overall health and well-being. When most people are asleep, air flows freely through the upper airways into the lungs, giving a stable level of oxygen in the bloodstream. In individuals with OSA, the tongue and soft tissue in the airway relax during sleep. As the tongue and tissue partially obstruct the upper airway, it causes loud snoring. When the tongue and tissue totally obstruct the airway, it causes an apnea and breathing stops. The chest continues to move as the person tries to breathe, but the blockage prevents fresh air from reaching the lungs. The oxygen content in the blood goes down. An apnea may last anywhere from 10 to 60 seconds before the brain recognizes that there is a problem. The brain briefly arouses the body from sleep, just enough to open the airway. The person with OSA can be observed snorting, gasping, or choking for breath as the airway opens and air flows back into the lungs. After several breaths, the oxygen level in the blood is restored. The individual falls back into a deeper stage of sleep. The tongue and soft tissue relax again, and the airway becomes obstructed. Apneic episodes can happen hundreds of times in a single night. The individual is most often not aware of their frequent arousals from sleep. They wake up feeling exhausted and sleep-deprived, even though they spent adequate time in bed sleeping. Although not as well known, sleep apnea is as common as adult diabetes and asthma. Recent studies show that roughly 1 in 20 Americans have some form of sleep-disordered breathing. Roughly 90% of people with sleep-disordered breathing are undiagnosed. While people with OSA and their families may not be aware of the actual disorder, they are keenly aware of OSA's classic signs and symptoms. Family members often describe excessive snoring, nighttime pauses in breathing, and snorting and gasping or choking for air during sleep. The most common symptom of OSA is excessive daytime sleepiness, despite spending adequate time in bed sleeping. Additional symptoms may include morning headaches, difficulty concentrating, memory loss, irritability, depression, lack of sexual desire, or impotence. To discuss the adverse health consequences of OSA, we have Dr. Kingman Stroll, Professor of Medicine at Case Western Reserve University. Hello, Doctor, and thank you for joining us.
Thank you.
Dr. Stroll, what happens if you don't recognize and treat sleep apnea?
Well, people have trouble staying awake during the daytime. They have inattention, they're irritable, and that's because they don't get refreshing sleep. They have problems with waking up at night, they have problems with apneas at night, and they have problems with just not getting their proper night's sleep. So the inattention and the sleepiness that occurs during the day is one of the major signs of sleep apnea.
Doctor, I certainly know how lousy I feel after just one night of poor sleep. Certainly I feel more prone to accidents, but can you tell me a little bit how this affects the heart?
Well, the apneas during sleep relate to, you wake up to be able to break from those apneas. The apneas also produce falls in oxygen level, increases in CO2. They stress your heart in 3 ways. The first thing it does is that during the apnea itself, blood pressure can rise. Secondly, your heart rate can increase, increasing blood pressure as well as heart rate. And the hypoxemia can cause the release of stress hormones. These lead to increased blood pressure during sleep and increased blood pressure the next day, and can contribute to the development of high blood pressure, stroke, as well as heart failure.
Can effective treatment relieve pressure to the heart?
Yes, it can. The key is stopping the apneas. If you stop the apneas, you stop the fall in oxygen level. You don't need to wake up to be able to restore your breathing. And you have uninterrupted sleep. And you cause your cardiovascular as well as your sleep-wake physiology to go back more towards normal.
Now, how about advice to someone that may have some of the symptoms of sleep apnea? What should they do?
Well, the symptoms of sleep apnea would be heavy snoring and pauses during sleep. Probably somebody else has told you about that. The other major symptom is daytime sleepiness, inattention, and just an inability to get things done. Now, if you have snoring, you have restless sleep, you have daytime sleepiness, you should talk to your doctor about those sleep problems. You should feel free to ask some questions about your sleep, and you should focus on sleep apnea as an issue of whether you need to be tested or have some other intervention to be able to reduce your snoring and improve your sleep.
And what about some of the risk factors?
The major risk factors are that of being overweight and your craniofacial structure. So in terms of obesity, people talk about obesity as being a major risk factor, and it is, but you don't have to be obese to get sleep apnea. Now the second is the craniofacial risk factors: large tonsils, large adenoids, short jaw. And both of these features, that is how your upper airway works, as well as obesity, could be familial. So if you have a member of your family that has sleep apnea, that's a risk factor for sleep apnea. Now there are other groups that are at increased risk, and that includes postmenopausal women, that includes people who snore heavily, and those are people who have certain endocrinological disorders like hypothyroidism, low thyroid levels, or growth hormone excess. And then there are groups of people that have sleep apnea because they have alcohol, use alcohol on a regular basis, or that they have sedative drugs that decrease their ability to keep their airway open at night.
Well, we certainly appreciate your insights.
Well, thank you, John.
When a sleep disorder is suspected, an overnight sleep study is conducted by a sleep specialist to determine the type and severity of the problem and the appropriate therapy. Sleep apnea is usually treated with positive airway pressure, or more commonly known by the acronym PAP, or PAP. PAP devices provide a gentle stream of air through a nasal mask to keep the airway open during sleep. Breathing becomes regular, and oxygen levels in the blood become normal. Restful sleep is restored, daytime symptoms are relieved, and health risks are reduced. Positive airway pressure is a safe and effective non-invasive therapy for OSA.
Well, to learn more about what it's like to live with OSA, we recently had a small group of people with sleep-disordered breathing problems pay a visit to our studio. I'd like to thank all of you for coming and sharing your experiences with OSA and PAP therapy. We'd like to welcome Lenita and Dave Myers, Raul Guevara, Dr. Matthew Abraham, Peggy Jennings, and Dee Stanley. What impact has PAP therapy had on your life?
You know, you have a problem when you're sitting in a car at a red light and the guy behind you is honking because you've fallen asleep at the red light.
I take public transportation, so I'm riding on the train, and I find myself that I was snoring really heavily. I would fall into this deep sleep, dreaming very, very vivid images, and then I would hear in the background the snoring, and I would wake up, and it would be me snoring. So I knew that there was something wrong there.
I'd come home from work, eat dinner, lay on the couch, and be asleep. I would sleep, if you added up in a day, I probably was sleeping or napping, 12, 14 hours a day if you counted all the naps in the evenings plus the action. I'd wake up to go to bed. Okay. Once I started using the therapy consistently, that all went away.
The impact of my life was a lot of things. I mean, I used to not be able to sleep in the same bed sometimes with my wife. I mean, I toss and I turn. We'd stay together for a little bit, but then she would get fed up because I was pulling the sheets off and waking her up and still in her sheets while I was there because I thought it was cold. I'd sweat. I'd have to go to the restroom. Numerous things. And also, during the day on the weekends, I mean, I'd fall asleep right after I woke up. I'd go back to bed for about 30 minutes. I'd go eat lunch. I'd take a nap. Before I'd go out at night, I'd take a nap again. And somewhere along the way, you realize something isn't right. And I mean, it just isn't normal.
You try to catch up on the weekend. Right. You know, say if you're not working Saturday, Saturday becomes a sleep catch-up day. And you end up sleeping 9 or 10 hours instead of 5 or 6 or 7. You feel worse, headache, tired. The more sleep you were trying to get, the more you felt you needed. And then by the end of the day, you were still tired.
And the anger actually built up early on because I was sleepless. He slept 8, 9 hours in my mind, and I was sleep deprived. And, you know, then it became a problem. And I was pretty, I think, forceful in getting him to go forward with finding out what the problem was.
What happened when you were diagnosed?
It's the best thing that could have happened. It's the best thing that could have happened to me. I'm healthier. I feel better when I wake up in the morning. You know, it's great. It's a feeling I haven't had in a long time. And I don't wake up tired. I don't wake up cranky. And, you know, I'm ready to do whatever I need to do for the day.
It changes him and us as a unit, that he has the ability now to actually have extra time to spend with us and doing activities, and he's much more active than he ever was prior to being on his sleep apnea machine.
It makes you a better father because you want to play with your kids. You've heard the stories about leave me alone, I just want to sleep, or go get a toy, I'll play with you later. And when you're not just wanting for sleep all the time, makes you a better father, makes you a better husband, makes you a better employee on the job, and then all of a sudden it's a good cycle that perpetuates itself. And then you realize, I think, that this is what normal life is supposed to be like, and what you'd been missing out all of that time.
I want to thank all of you for your comments. I'm sure that people with OSA are going to find them very, very helpful.
Listening to those interviews, Sherry, gives me an even deeper appreciation for a good night's sleep.
They made me think about the people in my life who snore. Does everyone who snores have sleep apnea?
Not necessarily, but as many as 50% of the people who snore may have sleep apnea, so your friends should be screened for the disorder.
And I will tell them you insist.
Well, tell them that habitual loud snoring is not normal or healthy.
John, what have you found most interesting as you've been working on this story?
As I've been telling friends and business associates about the OSA series, I've been amazed by the number of people who either know they suffer from the signs and symptoms of OSA or know someone who does. Many of these individuals are either unaware of the severe health consequences or choose to believe that the adverse health consequences won't happen to them.
And the evidence of the cardiovascular consequences of sleep apnea is relatively new.
The case has been building over time, but significant results have come to light in the past 5 years. New research efforts are now looking at the relationship between sleep apnea and other disorders, like diabetes.
And I'll look forward to hearing more about that research. John, what will you have for us in the next edition?
We'll take an in-depth look at the diagnostic process and treatment options.
Please join us for the next edition of Inside OSA, and thank you for watching.